I'm Dr. Mark Koh. I'm from Singapore and I work at KK Women's and Children's Hospital. I am a dermatologist, a pediatric dermatologist, and a dermatopathologist. So my first talk at the SPD was on histiocytosis. So I gave an overview of the different histiocytosis and the classification. I talked about Langerhans cell histiocytosis, which is probably the most important type of histiocytosis that we see in children. And we talked about the pathogenesis and the new discovery of mutations in the BRAF as well as other genes in the MEK, the RAS pathway. We talked about the diagnosis and clinical presentation of histiocytosis, and we talked about treatment of histiocytosis, in particular targeted treatments against the BRAF as well as the MEK mutations. So my second talk at the SPD was on the role of dermatopathology for pediatric dermatology. So I touched on cases that required biopsies to confirm a diagnosis, cases where a biopsy was required to exclude a diagnosis, and interesting cases where somehow the pathology did not fit the initial clinical diagnosis, and we had to go back to the patient to assess clinically again in order to come to a final diagnosis. I also talked about the utility of biopsies for genetic diagnosis, and finally I talked about the use of hair mounts to diagnose common hair conditions such as telogen effluvium, alopecia areata, and trichotillomania. I'm also the secretary of the International Society of Pediatric Dermatology, and we are trying to expand. We have almost 2,000 members now, but we are looking for more members, especially from America as well as from Europe, pediatric dermatologists who would like to contribute more to lesser served communities in pediatric dermatology. I'm also the president of the Asian Society of Pediatric Dermatology. So if I have been reaching out to lots of folks in Asia to encourage them to join the Asian Society of Pediatric Dermatology. Membership to both societies are free, and we have a lot of teaching material within both societies.